Jacqueline DuPont, a gerontologist in California, been around for about 25 years in our industry, and I'm here to give you some helpful tips for an older adult with dementia or Alzheimer's disease, either at home or in a facility. Today is part one of a 10-part series on caring for older adults with dementia and Alzheimer's disease. What I want to talk about today is the very difficult task of when is it time to move your loved one into either assisted living, memory care, or get 24-hour care at home. Very difficult choices to make, and when is it right? We usually look at many factors, starting with safety. Maybe the next time you go to visit your older adult, your loved one, maybe your mother at home, look at some key factors. Look at the kitchen. Open up the refrigerator. Make sure nothing's expired. Look for grime maybe in the bathrooms. Look at odors. Do you smell anything? Is there too much clutter? These are telltale signs of memory loss or not being able to live at home. Another, of course, safety factor would be falls. If they're falling more at home, if they're unsteady, if it's unsafe, if there's too many rugs, there's just so many issues that can cause falls, and especially with older adults with memory loss, there are so many more neurological factors. We know fall risk is very high and can be anywhere, in a facility or not, but having extra care at home or moving to a facility is safer. That's been proven. There may be also some money issues. They're not balancing their checkbook at home. You're seeing a stack of bills. You may be seeing too many charity thank yous. That might mean that they're getting taken advantage of. I also want you to look at, besides the refrigerator, look around and make sure they're not so bored. If they do have memory loss, are they just sitting all day? TV or no TV? There's no program, there's no exercise, there's no art. You know, it's very stimulating, and you often hear families say, "Oh, I waited too long to move mom. I should have done this 2 years ago." You rarely ever, in 25 years, have I ever heard someone say, "I did this too soon." That's really not the case. Older adults really need stimulation, and boredom is a concern. Even if you're going to add home care, you're at a caregiver at home, that would be a great alternative as well, but make sure they have a program. Make sure they're actually going to do some fun things, a walk. They may try playing the piano. They may try putting music on. They may try going to the mall. Whatever it is, have a program. Boredom is an issue for sure at home. Another telltale sign is nocturnal awakeness. If the older adult has memory loss, again, of any of the dementias, it may be a problem at night. You may have sundowning, agitation, and then you may have nocturnal awakeness, being up all night, roaming, wandering. Those are all real safety factors, and it is so critical to not overlook them. We know, especially in the state of California, that it's very expensive to have an older adult at home with 24-hour care. 12-hour care sometimes is more doable, but with the new regulations, unfortunately, we only have a 9-hour day in California before overtime sets in, and then you're paying that caregiver overtime. That's a big issue. So having multiple people coming in their home is hard. It's difficult enough getting one person in to care for your loved one, let alone 3 shifts. So all those factors need to be taken into consideration. When it's time to move, you may be feeling guilt, burnout, you may be feeling as a caregiver, stress. Just really think about how important it is to at least try this. Try to make their life a little happier, a little better in a new environment. They may be where they make new friendships, or at least they're being stimulated more. I hope these tips have really helped you. There's so many more to think about. There's health concerns, and I don't want to forget about the health concerns, because if you're noticing odors at home, you're noticing they aren't going to the restroom and making it on time, those are factors as well, because we really want a professional there to remind them throughout the day or to take them to the bathroom. You may also notice they're eating expired food. That's definitely a health concern. The urinary tract infections are more frequent at home just because they aren't getting reminded to drink water. So all these factors are really safety factors, but they all make sense once you've made the move and you see your loved one thriving, you see them eating better, gaining weight, families do say, dear Lord, I should have done this earlier. So please don't feel guilty. Try your best to take a good look around and a good, nice walk all over your community, asking around, trying to find out where is the best place for your loved one, or can they live at home with the caregiver. Either way, it's super critical not to miss the signs that we just reviewed. So thank you, and I'll talk to you next time.